Hello. Good evening, fellow friends and loved ones. Yes, once again, it's a very great privilege and honor to come to your homes as we continue our discussion on various health topics, various health conditions. Yes, previous weeks we had interesting topics to talk about, and I'm sure today is not an exception either as we journey in our new topic. Yes, I'm very grateful to come to your home. So today is the 11th of April 2021, and it's a very humble privilege. Okay, so we thank God for this day. We begin this presentation in the name of the Father and of the Son and the Holy Spirit. Okay, so this presentation's outline is the definition of the condition, the risk factors, the causes, the epidemiology, that is the statistics that pertain this condition, the characteristics of the clinical presentation, the diagnostics tools, that's how we can diagnose this condition, the medications, the medical management, the physical therapy or the physiotherapy management, and then likely surgical management of this condition, then the differential diagnosis, and then a case study of what has been done concerning this condition among hockey players, yes, and then other researches that have been carried out. Okay, so without much ado, I saw a quote somewhere which I want to share before we begin this presentation. Yes, so the quote was that a child's life is like a piece of paper that everyone has a portion to write his life on. So in fact, you should note that all of us here, we have to have infections in the bone, and so scientists have come together to bring some words together to give a name to it. And so osteomyelitis, osteo means bone. So anytime you hear osteo, osteoporosis, osteopenia, osteochondral, it means something that relates to the bone, osteo in bone. And myelitis is just an infection of the bone. Myelitis is an infection of the bone. So osteomyelitis means infection of the bone or bone infection, as our topic for this evening's presentation is about. Okay, so without much ado, let's zoom into the nitty-gritties of this condition. Okay, so osteomyelitis, actually we have two types. We have the acute osteomyelitis and we have the chronic osteomyelitis. Anytime you hear something called acute, it means it's a sudden something within 0 to 3 weeks or sometimes lesser. So you define a condition to be acute when it's within this frame, and then when it's chronic, it means it could be 6 weeks or more, or probably 3 months, or even years. So we say that a condition is chronic when it lasts for quite a longer time and is still persistent, that is still present in the person. Okay, so osteomyelitis actually, as the topic presented, a bone infection or infection in the bones. We mentioned that we have the acute and the chronic type. So osteomyelitis is a process involving the bone and its structures secondary to infection. So we should know that this condition is not on its own. It's actually a result of something, that's an infection in the body, which gets overboard and then causes it to be transferred into the bones, and the bones get infected. So we're talking about some condition that when we get, they can be transferred into the bone and cause the bone to be infected, and then we have something we call osteomyelitis. Okay, so we have some organisms that we call pyogenic organisms. Yes, and these organisms, their examples are bacteria. We have Staphylococcus aureus, that is the one that causes balls under your armpit. Yes, so we have other fungi, and then myobacteria. These are some organisms that when they are transferred from the body into the bone, they could cause infection to the bone, and then you could have osteomyelitis. So we mentioned chronic and acute osteomyelitis as the types of osteomyelitis. That is infection in the bone. Anytime you hear osteomyelitis, it's not a big word. It's just infection in the bone or bone infection. So actually, acute osteomyelitis is a clinical term for a new infection in the bone that can develop into a chronic type. when the intervention is not delayed. So actually we have one major type called acute osteomyelitis. That is when the body is infected with a condition, it moves into the bone and causes the bone to be infected. The first few days, the first few hours, we call it osteomyelitis. But then when intervention is not carried out, we don't treat the condition in the bone early, it could become worsened and cause that is chronic osteomyelitis. That is the advanced form of the acute osteomyelitis. Okay, so in the olden times, there was nothing like antibiotics. When you say antibiotics, they are medications that helps to prevent what infections. Yes, and so if you have probably an infection in your body, we give you antibiotics to go to fight this bacteria and then other structures. But then in the olden times, there was nothing like that. So people used to, that is the olden times, there were surgeons who used to carry out surgery on the bones to be able to remove these infections, and sometimes the survival rate is very, very low. And so this brought out scientists to think about how to be able to modify some structures or some drugs to be able to kill this bacteria or kill this fungi, to kill this mycobacteria. And so this brought someone called a penicillin. Yes, a scientist called penicillin, and he discovered a drug that was able to kill these organisms, this bacteria, and then these other structures. And then he called them antibiotics. So when doctors prescribe them for you, if you have infection in the bone, as early as possible, when you take this medication, they are able to control the infection and then take the infection away. But when you delay, then that's where you can have chronic osteomyelitis, and this could be very, very disastrous. So anytime you have we're talking about some clinical presentation, some signs that you see that will help you to see that probably you have an infection in the bone, then you can report to the medical doctor or the medical practitioner as early as possible. Okay, so I mentioned that in the olden days, they used to carry out surgical intervention, that's operation, to be able to take out this infection. But then as time went on, they developed medication, they developed drugs to be able to kill these organisms. Yes, some of the surgical procedures that they used to do was extensive debridement. That is, they creep off the infectious area, so that they take all of, if it's the muscle or the skin, they take all of, so that the organism is not able to spread to other parts of the body, which could cause so many disastrous effects. And then we had also suturization, we had wound packing. These are all medical terms that in the olden times the surgeons used to do to be able to reduce infection rate in a person. Okay, so actually the availability of this medication, that's the antibiotics, that actually reduce the mortality rate, that the rate at which people die. So they realized that yes, they had to produce more antibiotics, and actually has really helped in terms of infections across the world. If it wasn't for antibiotics, I'm sure that many of the infections that we have wouldn't have been able to survive if we didn't have antibiotics. Okay, so one very stubborn organism is the Staphylococcus aureus, and so when they discovered the antibiotics to be able to treat this bacteria, in fact, they were really happy. Despite that, our current situation still see that this bacteria are very, very stubborn. They're able to protect themselves. So if the medication is able to attack them fully and some is left, they're able to develop a level of resistance to be able to fight any antibiotic that comes again, and therefore they become difficult to kill. So then it makes the condition either not treatable or becomes worsened with time. So that's why it's very important that anytime you experience these clinical symptoms that we will be telling you very soon, you report as early as possible so that the best of treatment can be given unto you. So one research stated that about 40% of this bacteria become resistant to medication, that's the antibiotics, with time. So it showed that yes, this bacteria is very stubborn. Yes, it's very, very stubborn, and this microorganism is very stubborn. And so we look at some pathophysiology of this condition called bone infection or osteomyelitis. When you say pathophysiology, it means the disease itself and how it functions in the body. So it actually attacks the individual's immune system. Yes, so it means that we have to eat well, we have to eat very good diet, and we have to also make sure that we have enough sleep. We also have to make sure we exercise as best as possible so that our immune systems could be very, 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 very high. And so it's able to attack a weak immune system. And so this condition also, its ability to penetrate the body is one as a result of the type of the organism. If it's a bacteria, it's a fungi, the type could determine how hard or how resistant it will be, and the location of the organism. So if you have something like a virus like cold, yes, that is able to cause rhinitis, that is running nose, because the nose is always open, it's not closed. If someone has cold, the nearest person, if you are just near the person, you can get a cold because it's able to penetrate as best as possible. The nose is always open, so it's one of the stubborn condition that is running nose. Yes, that people really fight with. Yes, and also depends on the location. As we said, the nose or the ear. If we have sinusitis, it's a condition, or we have tinnitus. Okay, and also the vascularity of the involved bone. So if the bone also is not well vascularized, that is, there's not enough blood in the bone can be infected as best and as early as possible. And that is why we come to exercise and also ensuring that there's movement in the affected body part or in the body part. Okay, so we'll talk about the risk factors. So what are the risk factors to this condition called bone infection or infection in the bones or osteomyelitis? One, the risk factor is smoking. So if you smoke a lot, in fact, there's a science study that smoking also tends to affect the level of strength in the bones, and then it exposes the bone to infection as vulnerable as possible. The bone becomes vulnerable if you smoke a lot. So if you know someone who smokes a lot, tell the person that, then the person is likely to have osteomyelitis, which is very, very disastrous, and the person could die. So you can explain to the person about this condition, osteomyelitis. And also people with chronic health conditions such as diabetes. Diabetes has actually a relation with this condition called osteomyelitis because of the fact that diabetes actually affects the vascular system. So we have a lot of sugar in the blood system, and then the blood vessels also carry blood into the bones. So when you have interruption, that is the extraordinary amount of glucose in the blood, it could also cause the bones to have less amount of nutrients in the bones, and then they begin to compete with the few amounts of nutrients in the body, and then the bone also could be deprived of enough blood, and this could cause exposure of the bone to infection. Also, we could have someone have kidney failure. The person is likely to have osteomyelitis. That is, the person's, because the kidney is not functioning well, any disease, any organism that comes could attack the kidney, and then the kidney is very important in terms of absorbing nutrients and so many things. So if it's affected and the kidney is not functioning well, then you distort the normal function of the kidney, and the kidney could be exposed to infection. And also people who have compromised immune system, such as HIV. I know that the statistics of HIV in the country is not on a high, but then if you have HIV, you are likely to have this condition called osteomyelitis because your immune system is exposed to any organism, any microorganism, and then you could have osteomyelitis. Okay, and also we have people who abuse drugs. Yes, those who like taking drugs anyhow. So if you have headache, you just go to the pharmacy, don't take tramadol. If you have running stomach, go and take any medication. You say, oh, I think this medication is good for me. Yes. So it's advised that if you have any complaints, you need to see the appropriate medical practitioner so you can have the best medication, because when you abuse drug, you tend to expose the immune system to any condition, and then osteomyelitis is also a condition that you can have. Okay. And also, if you have a recent injury, or if you had a surgery that is involving your bones, that's the big surgery, when the wound is not fully healed and is exposed to the environment, it can be infected, and infected wounds can cause osteomyelitis, that is infection in the bone, and this could lead to other complications. And moreover, if you are also diabetic and you have had a surgery, you need to protect the wound very, very, very well, so that it can heal well, because it's very, very critical for you returning back to function as best as possible. Okay, so we will look at some epidemiology, some statistics showing the prevalence of this condition called osteomyelitis. It's shown that from 2 to 12 years, we have more people, that is probably not in this country called Ghana, but outside, it was showing that between the ages of 2 and 12 years, we had more people having osteomyelitis or bone infection. And then also, as they grow older too, because of the immune system that is compromised, that is not so strong, we have low hormonal production. The body is exposed to all microorganisms, so many microorganisms, and because they have chronic health conditions exposed to, and they tend to have this condition called osteomyelitis. And so this is some statistic that was carried out outside, but then inside Africa or in Ghana, we are yet to have a very substantive research to be carried out. Yes, I might not have read it though. Yes, and also people with circulatory disorders such as peripheral vascular disease, that is where we have difficulty or impairment, or we say inconsistent movement of the blood in the vessels. So this could also cause infection in the bone, because the blood is sent into the bone. The bones also need blood to be able to become nourished and strong. Yes, that's why we exercise, and that's why also we have enough rest so that the bones also can become strong. Yes, okay. Also, problems requiring intravenous catheters, that is where we have if someone is not able to pass out urine, or we have something we call catheter, and so if it's inserted into the genital areas, our medical practitioners make sure that they are not dirty, they are not infected before sending it through the passageway. But then, in case of the fact that they are infected, this could also cause someone to have infection in the body, and then likely osteomyelitis. And also someone with sickle cell disease. So if you have sickle cell, your sickle cell disease actually is where we have the red blood cells that's in the body looking like a sickle cell. So they are like this, and then they don't allow enough oxygen into the body, and then people with sickle cell actually have poor blood clotting. So their blood, when they get hit, their blood is not able to clot as best as possible, and then they tend to are exposed to so many conditions, and osteomyelitis is also part. We also have a condition we call systemic lupus erythematosus. These are our conditions. I'm sure you've not heard it before, but if you have this condition, you're likely to have osteomyelitis or bone infection, or infection in the bone. And also, very, very important, this point, malnutrition. If you don't eat well, your immune system will become weak. So those who eat gari, and gari and sugar without eating balanced diet. I know taking balanced diet doesn't mean you should go and eat fried rice and chicken and then sausage and then salad. Yes, a balanced diet, you can take in kinky and fish and pepper. Yes, you can take in wache, you can take in rice and stew with some fish, with some small fish, with some egg. Yes, it's a balanced diet. But then if you only eat rice without anything, you are exposing yourself to beriberi, you're exposing yourself to this condition called osteomyelitis, and your bone will not be nourished. Your bone needs a lot of calcium, fish, to be able to become strong. bones to become strong. So therefore, we are encouraged that we should eat very, very well. And also, if we have chronic hypoxia, that is poor amount of oxygen in the body, you have breathing problems, you could have this condition we call osteomyelitis, because the bones also need an amount of blood and oxygen to be able to survive. And also extremes of age, so the young people also are exposed to osteomyelitis because then their immune system is also strong, and when you are so old to the same thing. So the extremes of age have their immune system compromised, they're not so strong, and this helps them to be exposed to this condition called osteomyelitis, or infection of the bone, or bone infection. So how prevalent is this condition? Actually, this this prevalence has decreased throughout the years because there has been consistent education, even as we are doing now, so that we can minimize the occurrence. That is, early recognition of this condition helps to minimize the infection rate of the condition or the organism, because when they notice them early, we can get rid of them as best as possible. Okay, so in fact, hospital rate admission of this condition has reduced, and this has been encouraged. It has been encouraged for us to be able to battle this condition and in fact get rid of it. Though it looks like we might not be able to get rid of it, but we can be able to manage it to the best of our ability, and then we can lead a normal life. Yeah, that's very important. So when it's noticed within a research stated that when it's noticed within the hours, that is between 48 hours, we have a very good rate of combating this condition. But after 48 hours, then the organism is able to lay its strength, that's foundation, and then becomes a bit resistant to medications and other therapy. So a research also carried out between the years 1969 to 2009 stated that yes, people who are 40 years and above tend to have this condition called osteomyelitis, and also as they grow old, or as they grow older to about 60 years and above, this condition increase. That is 3 times the likelihood of the person having this condition, and this was a cause for alarm. And so as time went on, they found out that yes, they had to take a keen interest in terms of treating this condition. And also this condition was more related to diabetes, so people who had diabetes were likely or more likely to have this condition called infection of bone, or osteomyelitis. And then the statistics say that about 2.3 out of 100,000 cases had this condition within the year 1969 and 1979. And then yes, in the year 2009, about 7.6, that is about 8 cases out of 100,000 people had this condition called osteomyelitis. So as the year went by, the more recording of cases of osteomyelitis, it could be not because there was actually an increase, but then it was more because there was early reporting of the cases and early recognition and early treatment of the condition. And so there was actually good prognosis and then good treatment in those recorded years. And so this condition, this organism called the Staphylococcus aureus, is one boss of this condition called osteomyelitis. So when you have Staphylococcus aureus, a research stated that about 44% of people who have this organism in their system tend to have the bone infection or osteomyelitis when they are not treated very, very effectively. And also another research stated that children, the amount of children who had osteomyelitis in the year 1970 increased from decreased from 87 to 47 out of 10,000 of people who had this condition, osteomyelitis. That indicated that there was quite an improved level of treatment and level of education in terms of having this condition. And so we had, apart from the diabetes related osteomyelitis, we also have a type called the vertebral osteomyelitis, and then this actually affects the back. So we have infection of the back. So there are so many conditions that if you have probably had a surgery at your back and then it's not healed well, it could be infected, and this could result in something we call vertebral osteomyelitis. That's when you have the bones being infected. Okay, so and this type of osteomyelitis, that's the bone infection, actually had the prevalence of about 2.4 out of 100,000 people. And actually, as time went on, also there was also an increasing rate of infection that's recorded for the vertebral osteomyelitis. So it moved from 2.4 out of 100,000 people to about 6.5 out of 100,000 people. And then the ages actually were the first, that is the 2.4, were about. Yes, so sorry for the interruption. So we're talking about the vertebral osteomyelitis, that is bone infection. Yes, so there was a little hiccups. Yes, and so the vertebral osteomyelitis, that is bone infection that's at the back. So when you have the backbone infection, so at your back, you have bones at your back. So if you have the bones being infected at the back, you could have vertebral osteomyelitis. It's one type of osteomyelitis, that's a bone infection. The first one we talked about was diabetes-related osteomyelitis. That's when you have diabetes, you could have infection in your bone as a result of diabetes. And the second one is the vertebral osteomyelitis. That is the bone infection at your back, the backbones being infected. And so the prevalence increases with age. So as the person grows older, for about 70 years, we have a higher prevalence because they have a weakened immune system. So it's shown that there's high mortality, that people died as a result of vertebral osteomyelitis, because of other conditions also that came along with it. So how can we notice this condition called vertebral osteomyelitis? We have characteristics of this condition. So when someone has this condition called osteomyelitis, yes, how do we notice that someone has it? First of all, one, the person has pain around the affected regions of the body, or tenderness. When you say tenderness, when you touch the place feels a bit soft, and the place feels a bit indifferent from the other parts of the body. Okay, so the person actually complains of pain around the side. So if the person has back pain, so someone who has back pain doesn't really mean that the person just has pain at the back or the bones are not so strong, but it could be infection at the back. So we take a very good assessment of the condition or the complaint before then we give the treatment, because if you don't do a very good assessment, yes, you can't get a better treatment. Okay, so aside pain, there could be inflammation. That is, you could have swelling around the side, there could be redness, and there could be warmth. The place, when you touch the place feels a bit warm, and then when you touch the place, you feel like quite warm or a little bit hot. Yes, and then also the person also feels like vomiting. The person has nausea, and then generally the person feels ill, because in fact when the infection attacks the back or the bones, it actually affects the whole body, including the brain, because there is discomfort in the person. The person feels ill at the time of infection. Also, the person complains of low back pain. That is in terms of the vertebral osteomyelitis. Yes, the person could have also swelling in the legs, in the ankles, and the feet. Yes, so these are some of the signs that you could see that the person has osteomyelitis, be it diabetes related or vertebral osteomyelitis or other types. The person also could have joint pain. So the affected body parts could present with joint pain. You could have in the feet, and when you have feet in the pains in the ankles, or joint pains around the ankle regions, or the lower back in the joints, or the elbow or the wrists or the other body parts. And also the person could have reducing function. So if it's the wrist, the person cannot lift things very, very well. If it's the ankle, the person cannot walk well. The person walks in a limping mode. So the person begins to limp as the person walks. And also the person has fever. The person could have fever. The person could have general body weakness and swelling around the body part, the affected body part. The person could have antalgic gait. When you say antalgic gait, it means the person limps as the person is walking, and this will be as a result of infection in the bones. Okay, And one very important point we should note is that we could have primary osteomyelitis and we have secondary osteomyelitis. Actually, the primary type is actually manifested in both children and adults. Yes, and then it will depend on the level of the infection. So it could affect children and could affect adults. For the children's type, it tends to be more acute than chronic, because then the children have a very good tendency of recovering as best as possible than an adult who has an immune system which is a little bit compromised and then very difficult to bring back to the normal strength. Okay, so for children, it could be between the weeks of 2 weeks, yes, 2 weeks, and could have osteomyelitis. The person could have actually a pre-existing condition, pre-existing infection of the body. And one important microorganism is the Staphylococcus aureus. I've mentioned it in the some previous seconds or minutes ago. And the person could also have, a child could have high fever, and then this could be as a result of infection of the bone called osteomyelitis. And in some cases also, we have other presentations of the child. The person could have tenderness, the person could have swelling around the body parts. For adults, the adults tend to have subacute, that is more than 3 weeks, or getting 3 months, or 3 months, 6 months, even years, and of this pain, this tenderness, this swelling, and then it could be very, very discomforting, Other likely cause of this condition could be as a result of trauma. So where you've hit a part of the body, that is, in older people, if you have frequent or consistent falls, there could be injuries or there could be fractures that could cause infection around that region, and it could have osteomyelitis or the bone infection or infection in the bones. Okay, so when we look at some further causes of this condition, we could have other organisms we've mentioned earlier on. One of the boss causes, that is Staphylococcus aureus. Yes, this is very stubborn. It's able to attack the immune system, and when you're even taking antibiotics, sometimes the antibiotics is not able to really destroy the whole host or the host of the system, and so therefore they're able to resist the antibiotics. So medical practitioners tend to give it or to prescribe a stronger antibiotic to be able to fight this Staphylococcus aureus. So other organisms also that could cause infection in the bones, we could have Pseudomonas, we could have Klebsiella, we have Salmonella. These are all scientific names. We have Escherichia coli. These are all organisms that will cause infection in the bone. And then, as we mentioned earlier on, it could affect so many areas in the body. It could affect the ankle, the knees, the elbow, the back, yes, the feet, so many areas in the body. And so far as it's habitable for the organism, that is the microorganism, it could affect the microorganism. And also affects different types of people. It's irrespective of the people, irrespective of the person. So far, so immune system, which is very, very key component, is compromised. It could be infected by this condition called osteomyelitis. Okay, so other researchers stated that also that the vertebral osteomyelitis, that's the one that affects the bone, the back region, most adults are affected by this type of osteomyelitis, that the vertebral osteomyelitis. Most adults are affected. And also another study also stated that once the particular components of the bone, that is, we have a structure we call the cartilage. So in between two bones, we have a cartilage which helps prevent the impact of two bones together. That is allowing to prevent friction. That is them wearing away each other. We have something we call cartilage, and this cartilage helps to give a very good movement between bones. And so when this cartilage is infected by this organism, this will also result in osteomyelitis. Therefore, it could also transfer this infection to the bone. and this will cause osteomyelitis, that is bone infection. This could be as a result of stimulation of something we call endotoxins. It's a scientific term, and this could cause a release of these toxins, and this could infect the bone and cause osteomyelitis. We have other organisms that also could cause osteomyelitis. We have the Pseudomonas, we have the Haemophilus influenza, we have the Escherichia coli, which we mentioned earlier on, and these are all capable of causing infection in the bone, and this will cause osteomyelitis or bone infection. Okay. So it's very, very important that we take notice of these likely causes of osteomyelitis. Okay, so we look at, you mentioned that aside the medical management, aside the physical management, we have surgical management also, which are very important to be able to treat this condition. Surgical procedures are very important, because sometimes when you do all the therapy, especially to the bone and it's infected, you can't do anything, but then you have to take off that particular side, because when it's infection can spread throughout the whole body, and so we have to curtail that. We have to control the infection in the particular. If it's your hand and the wrist is infected, you have to cut off your hand so that the infection in the wrist doesn't spread throughout the body into your heart, because when immediately your heart is affected by the infection, it could cause you to die. Yes, and we want to prevent death, so we have to cut off that particular part of the body to allow the infection to stop spreading. So we have implanted devices that also helps to control the rate of infection. We have another type of infection we call the bone infection we call Exogenous Osteomyelitis. That is where we have the bone coming out. So in case you are sitting on a motorbike and then you fall down, the bone comes out. The bone can be infected by the environment, that is the floor there, and it could cause osteomyelitis or bone infection. And then very important, we have to talk about immune system. So if your immune system is compromised, you don't eat well, you could have osteomyelitis, because the bones can be exposed to infection. And so let's take note that we have to eat well, eat a balanced diet, and then we are free from osteomyelitis. Also, we have something we call also, aside the vertebral, the diabetes related, we also have something called Hematogenous Osteomyelitis. Actually, this one is acquired from the spread of organisms from pre-existing infections such as boils, the persistent boils that we have found. The scientific name is furunculosis. If you have a lot of boils, the boils under your armpits, boils everywhere, this will cause your bones to be infected, and then resulting in osteomyelitis. If you have also respiratory infections, if you have infections in your teeth, if you have sinus infections that's in your ears, you could have osteomyelitis. You can be predisposed to have osteomyelitis. Also, how can we diagnose this condition? We have this condition is actually difficult to diagnose, because you have to go to take blood tests, and then just the symptoms can look like other conditions. So we go to take blood tests whether there's infection in the blood, and then this could also help us. It's also actually a very important key note that when through blood tests, we can have us identify the infection or the infectious organism or microorganism to be able to treat the condition as best as possible. So the signs and symptoms also helps us to be able to treat the condition very, very well. Aside that, we could, if it's the vertebral type of osteomyelitis, that's the osteomyelitis that affects the bone, the backbone, we can check an MRI. You can see the misalignment or the degeneration of the bones around the side, and this could also help us to be able to see and diagnose this condition. Actually, the bones will not show any sign of abnormality within 10 days, but after 10 days, the infectious organism attacks the bones and causes destruction of the bones. And so after 10 days, you could see the signs of infection in the bone through the MRI, through X-ray, through a type of scan called fluorine 18 fluorodeoxyglucose positron emission tomography. It's a big word myself. You see, I'm struggling to mention it, but these are all tests that helps us to diagnose this condition called osteomyelitis or bone infection. So aside the tests, also we also have medical management. So we also take antibiotics, as we mentioned earlier on. Within the first 4 to 6 weeks, that's the acute stage. Antibiotics helps a lot to be able to resist further infection and causes the infection to become chronic. Okay. Also, we have procedures called draining the infected area, and these are also moving necrotic bone and soft tissue. We have debridement, which can be done to be able to reduce infection rates. Also, restoring normal blood flow to the bone, to exercise, to medication. That's the medication that we take in to be able to open up the blood vessels so that we can have enough nutrients and also resist infection. And then also we have the extreme part, that's the amputation. That's when we mentioned earlier on, we cut off the particular part of the body to prevent further infection to the other parts of the body. Aside the medical management, we also have the physical therapy management. Actually, the physical therapy management depends on the diagnosis of the condition. So if the condition is diagnosed, we also take caution in terms of if it's the back, we have other therapy. We have warm therapy, or we have gentle exercises to ensure that the place doesn't get stiff, and also we ensure we engage in gradual progressive exercises to bring strength to the bone, and also to ensure that there's enough blood to the bone to ensure the person functions very well. The other complication that could result if we have osteomyelitis, and it's very, 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 very important that we take notice, because if the body is infected, it could cause infection into other parts of the body. You could have infection in the lungs, because when you don't control the infection through medication, through early medication, it could also cause other complications to your lungs, to your liver, to your kidney, so many conditions. So early treatment is very, very key for good recovery. And also we have to eat well. So I'm sure my fellow dietitians will understand me that it's very, very important that we have to eat well to ensure that we have a good immune system, because a compromised immune system could expose us to have bone infection or osteomyelitis. It's very important. So aside this, we have other conditions that could look like osteomyelitis. I'm sure when I mentioned them, they are a bit big, but let's take it like that. We can read upon them and then get to know upon them. We have the Erythematosus. So we have, that is a form of cancer, and this could look like this condition called osteomyelitis. But through various investigations, we can rule out this condition and then further diagnose this condition called osteomyelitis. We also have reactive bone marrow edema. We also have traumatic stress fractures. We also have inflammatory arthritis. We also have gout. That's infection of the big toe. So if the big toe is the only one infected, we have other tests. We've talked about gout some time ago. So if you want to read on gout, or you want to know more about gout, you can just search this on Facebook about gout on my Facebook wall. I'm sure you see a very extensive discussion on gout of this condition. Or if you want a request, you can just PM me. You can private mail me, and I can send you the link to watch on gout. Yes, thank you. Okay, so a case study also was carried out among hockey players, and they realized that although hockey players also are likely to have other conditions, this condition called osteomyelitis also had a relatively high prevalence, that is, had a likelihood of being associated with these people called hockey players, and actually they presented with unexplained acute back pain. That is, within the first day and in 3 weeks they had acute back pain. That they had a high level of back pain. So they tend to have this type of osteomyelitis that we discussed earlier on, the vertebral osteomyelitis. Okay, there has been so many research that have been carried out, and I'm sure if we take a very good interest in this topic, we can learn a lot, we can read a lot on the net. Okay, so I'm sure we've come to the end of our discussion, but before we leave, we look at some pictures as usual of this condition. Yes, and then we can have a fair idea of this condition. Okay, so this is what we are talking about, osteomyelitis. Yes, so it affects actually the bones. So you can see, if you compare the two, you can see this bone, this is a leg bone, you have the tibia and fibula, this is the normal bone. You can see how whitish it is. But if you compare these two, you can see that this one has lost its whitish nature. There's some darkened portion around this region. Yes, you have this darkened portion around this region, and you can see it's not so whitish as this one. And this could give, through the X-ray, we can say the person is likely to have osteomyelitis. But other tests, that is lab tests, can confirm the occurrence or the incidence of osteomyelitis. This is also the leg bone. You can see the red sign that shows the infected area, yes, of osteomyelitis. You can have the knee. Yeah, this is an MRI, a very good MRI that shows the infection. You can see it here. You can see how darkish it is. Okay, so this is also an example of osteomyelitis. You can see the greenish region here indicating osteomyelitis. Okay, and so these are some of the symptoms that someone who has osteomyelitis will present. As we mentioned earlier on, fever and chills, redness and swelling in the affected area. We have lack of energy. The person gets tired easily, which is scientifically called malaise. And then the person has irritability. The person gets annoyed easily. The person becomes uncomfortable. And also, you can see this is a very typical presentation of this condition called osteomyelitis. You can see the infected area looking a bit bruises. Okay, so this is an example, an extensive description of this condition. Yes, okay, so this is an MRI. You can see the back here this bone looks very inconsistent. You can see the darkened area. So this region of the bone looks not so whitish, and this could infer osteomyelitis presence. So you can see the bacterial infections. You can see the person has swelling around the side. This is a typical example of the vertebral osteomyelitis in children. Vertebral osteomyelitis in children. So you can see it from this angle. Vertebral osteomyelitis in children. You can see it, the child. And then so in the toes, you can see it here by bacterial infection. Okay, and this is the hip region. Osteomyelitis in the hip region. I'm sure you can see it very extensively. This is the toes. This is the back in a child who has vertebral osteomyelitis. Okay, this is also the hand. You can see the this is called the radius. You can see the radius bone is very unwhitish. So you can see the osteomyelitis of the bone here. Another example. You can see the bone here, osteomyelitis. You can see this gives an extensive description of the condition osteomyelitis too. Okay, so some pictures, yeah, more pictures. This is a surgery carried out by someone who has weak bones. So the person has a weak leg bone being affected, so the surgery has been carried out to be able to treat this condition. The person broke the bone, that had a fracture of the bone, and then the surgery was carried out to put implants to be able to stabilize the bone, and then it was infected. So therefore they are protecting the bone very, very extensively to allow the bone to heal very well. So this is another picture of the bone. Okay, so very well said. I'm sure we've learned a lot this evening, and I'm sure we'll be able to give a very good account of this condition called osteomyelitis to anyone. And you can log on to the YouTube page, which will be shown to you very soon, and then watch other previous videos, previous discussions, previous health condition, and I'm sure we'll have a lot to learn from. Okay, so without much ado, if you have any question, I'm sure I saw people coming in and going out. Yes, and I thank you for your time. Okay, I can see Abdul Eskandari. I can see other people coming to join in. Yes, so thank you very much for your time. I'm very grateful. We bless God for a successful presentation. And so our next topic so today is 11th, so next week will be 18th of April. Our next topic will be a very interesting topic. Yes, I'm sure you'll be very, very keen. And so when we see the flyers, let's all share, and then let's share the link so that we all watch. And then our previous slides, our previous videos too, we can share them to our loved ones to watch. Okay, so our next topic for discussion is a condition called Spondylolisthesis. Spondylolisthesis is I don't want to talk about this. Yes, we'll talk about it next week. And so it's also presents itself with back pain. Yes, back pain. And so we'll talk about it and announce in this discussion. So thank you very much for your time. May the good Lord be with us. So have a blessed evening. Have a wonderful week. And see you next week. Take care. Bye.